1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Bear with us a moment while we warm up here. Just a second. Morning, Paul. So first, I'd like to thank everyone for tuning in this morning. We have a great deal of information that we want to share with you today, so we'll get right to it. Per usual, we're joined today by County Executive Armin Budish, and we have an important partner here today, President and CEO of the Metro Health System, Dr. Akram Boutros, who will speak as well. You'll also hear a bit from me and from Dr. Heidi Gullett, as is customary with her data roundups, our medical director, and Ramona Brazil, our co-director of prevention and wellness. So first, we'll hear from Executive Budish.
Good morning. Thank you all. I'm glad to be here to address you today. As this crisis continues and we continue to feel the effects of it, I'm very grateful to have the opportunity to work with Terry Allen and Dr. Gullett and all the great staff at our Board of Health here. I can tell you they are truly caring and compassionate and devoted. Today I want to make two important announcements. First, several weeks ago, I stood here and announced that the county, along with many other funders and many other partners, that we were all launching a small business loan stabilization fund. That fund was set up to deliver both grants and low-interest loans. We launched it at 9 a.m. on a Friday right here, and by the following Monday, we had received 3,100 applicants. Obviously, we had hit upon a tremendous need. It really struck a nerve. It was gratifying, but it was also concerning because it really showed that the need is out there. Of the total, about half met the eligibility requirements. Our committee of experts went through the applications and selected 200 small businesses to receive $2,500 grants. We also have loans available through the program, and we've encouraged some of the people who applied to apply for those low-interest loans as well. While I'm thrilled that we were able to help 200 small businesses to survive, we still need to do more. We have to help more of our small businesses to get through this. So today, I'm announcing a round 2 of the county's Small Business Stabilization Program. The second round will provide a total of $2 million in grants, $1.5 million from the county and $500,000 from the Cleveland Foundation. I want to extend my sincere thanks to Cleveland Foundation CEO Ron Richard and to the board of the foundation for their very generous support. With this new round, we anticipate being able to help 600 more local small businesses throughout our county with grants from $2,500 to $5,000. This second round is now officially open, and small businesses can go to cuyahogacounty.us/stabilization fund to learn more about the eligibility requirements, to fill out the application, and to get any other information that they need. Business owners can also call our Small Business Resource Center at 216-452-9714. They can call Monday through Friday from 8 a.m. to 5 p.m. We'll be giving special preference to business owners with a personal residence in Cuyahoga County and businesses in low to moderate income census tracts. We're prioritizing the following types of businesses: the service industry, like restaurants, bars, personal care, and cosmetology, hospitality, neighborhood health care, grocers, general contracting, construction, and manufacturing. And just to be clear, these grants are for small businesses. Businesses with 25 employees or less are eligible. The Business Resource Center number that I just gave is also available to any business which is looking for help and guidance in navigating through the various local, state, and federal programs that are available. I want to thank Joel Ratner as well. He's with the Neighborhood Progress Center, and he's here today with us if anybody has any questions. The Neighborhood Progress Center will be administering this second round of grants, and we greatly appreciate their assistance and expertise. Thank you, Joel. Small businesses are the lifeblood of our communities. I know that these are very difficult times. We want to do as much as we can to help. Now for my second announcement. Testing, testing, testing. We've all heard about the crucial importance of testing if we're to safely reopen the country and stop the spread of COVID-19. An article in The Nation just stated that, and I'm quoting, "The path out of the pandemic for the United States, indeed everywhere, centers around a massive scaling up of testing." Testing is important to help diagnose individuals. Knowing who's infected can allow healthcare professionals to better care for people who have been infected and plan for others. The director of the World Health Organization said, and again I'm quoting, "We cannot stop the pandemic if we do not know who's infected." English Prime Minister Boris Johnson, who can speak from personal experience, believes that testing is how we will unlock the coronavirus puzzle. This is how we will defeat it. Unfortunately, we've not been able to do the testing that we need. There's been a terrible shortage of tests, shortage of reagents, nasal swabs, and the people and equipment necessary to conduct and analyze the tests. The lack of testing is particularly dangerous in congregate settings, congregate hotspots, where residents are particularly at risk. When Terry Allen and Dr. Heidi Gullett present their numbers each week, the sad numbers of infections and fatalities are skewed by the hotspots. Today, I'm announcing that we will be substantially increasing our testing. The county is providing $5 million to the Board of Health for 30,000 tests. These tests will determine if people are currently infected, not if they've had the disease in the past. They will focus on priority groups in the community. Testing locations will include hotspots or clusters detected by the County Board of Health, and congregate facilities like homeless shelters, community health centers, adult homes for those with developmental disabilities, churches, nursing homes if not already affiliated with another provider, and other neighborhood sites. Tests will be conducted by Metro Health with the guidance of the Board of Health in drive-through locations and mobile testing sites. I also want to underscore two things. First, this testing plan is about equity. You hear each week at these briefings that the pandemic is affecting African Americans and the poor in greater proportion. There are people in our community who sadly do not have the health support to be tested, and they're living in congregate or group settings. We want to make sure that we are focusing on the elderly and those with underlying health conditions. Second, this testing plan is a true collaboration. Since this crisis began, the county's been working closely with Metro Health, our great public hospital. Metro has stepped up again and again and again and again. Each time that we've asked for more help, whether in our county jail or elsewhere throughout the community, Metro Health has been there every time. And as I've said many times here, the Board of Health has been working tirelessly to keep us safe. So this collaboration that you see between the county, Metro, and the Board of Health has really worked well. With this increased funding, we are amping up what is already a well-oiled machine. We are all working to keep you safe. And now I'd like to ask CEO of Metro Health, Dr. Akram Boutros, to come and address you.
Good morning, and thank you. I'm happy to be here with County Executive Budish and our Commissioner of Health, Terry Allen. We also owe a debt of gratitude to our Council President, Dan Brady, who helped us with this partnership. Our teams have been working together for 2 months addressing care for the vulnerable communities. Today's announcement highlights our collective efforts to protect the health of residents of Cuyahoga County. Throughout this pandemic, Metro Health has never wavered in our commitment to serve our community's most vulnerable. We've been doing this for 183 years and have tackled similar outbreaks: cholera, Spanish flu, TB, polio, and HIV. Since March, our teams of Metro Health physicians and nurses have tested and cared for people living in homeless shelters, on the streets and camps, nursing homes, and group homes, places where social distancing and spread is easy. In partnership with Cuyahoga County and the Department of Health, we are ready to expand this important work across the county. We want to expand it to shelters, group homes, nursing homes, addiction recovery housing, jails, prisons, all group living settings where there's a higher risk of transmission and impact. As we reported 3 weeks ago, our modeling has shown that these clusters, as opposed to large communal spread, will be driving the infection rates across our community in the coming weeks and months. We are ramping up our testing capacity to match the need and are diligently working on having the staff, equipment, and supplies to test up to 2,000 people a day. For people who haven't previously experienced Metro Health, this is what we do, and we have been doing for nearly 200 years. We respond to crises, keep our communities safe, and care for everyone regardless of income, insurance status, or other hurdles they may face. I want to remind everyone to continue wearing masks in public, washing our hands, and staying home when feeling sick. And if you are feeling sick, no matter where you are, you can call our COVID hotline. That is 1-440-59-COVID or 1-440-592-6843. And for any congregate living environment that wishes to connect with us, you can send an email to us at wecare@metrohealth.org. That's wecare@metrohealth.org. Finally, we've survived 8 difficult weeks, and together we can make progress over the next phase. Thank you very much.
Thank you, Dr. Boutros, and thank you, Executive Butis, for your partnership. I'm very grateful for this strong partnership that has really expanded during this response to address this unprecedented public health emergency. I'm reminded that in late February, I was at Metro Health with Dr. Boutros and Governor DeWine and Dr. Acton before this process began, and we were talking about the importance of partnership and the importance of public health in the response. And time has passed by quickly, although for some of us, as we pause, it feels like years since we were back the way things were before the pandemic. And so this enhanced community testing initiative highlights this important relationship in concert with our many public health and clinical partners in the community. Our hospitals play a key role in testing in their patient populations, as well as residents and staff in long-term care facilities. That's an important role that they're playing in the community. Along with Metro Health, we continue to collaborate with the Cleveland Clinic and University Hospitals in the response zones that were established by Governor DeWine to support the vulnerable populations in these institutions. The idea here is that if you have staff in congregate facilities that then become exposed and COVID positive, they then potentially circulate out into the community, into their homes, into grocery stores, into other places where they may work, and begin to spread and create new chains of transmission that cause further cases and fatalities. This is what we're trying to prevent. So combine these efforts with the hospital systems and this expanded community testing strategy will allow us to reach a much larger population of those at risk, following the new testing guidelines from the Ohio Department of Health that Dr. Gullett will detail in a bit. Public health plays a pivotal role in the ongoing COVID pandemic response. There are 4 key things that we do. We detect, we diagnose, we isolate, and we contact trace. These have been the tried and true pillars of public health disease control for over 100 years. They've stood the test of time because they work. With the welcome support of Executive Budish, our expanded collaboration will allow us to continue our focus on the detection of hotspots in congregate facilities. Metro Health's expanded support will help us to test a wider range of at-risk people, which is essential in controlling community spread and breaking these chains of transmission. As we've heard, testing sites will include places like homeless shelters and community health center locations, adult homes for developmentally disabled, churches, and other neighborhood sites. The intention is not to test every single person and everyone in the community. That is not the intention. We're focusing on vulnerable populations. The state has set a clear set of guidelines on testing eligibility, and we intend to follow those guidelines. We'll work with our community partners on these congregate and community settings where we can practically reach the most people for testing. We know that these environments are in need of increased testing capacity. We'll also continue to perform our contact tracing, isolation, and quarantine duties as we have since the beginning of this pandemic, and releasing cases once they return to good health, working closely with our partners at the Cleveland Department of Public Health. So we'd like to thank the county executive for his leadership, Dr. Boutros and Metro Health for their enduring spirit of collaboration as we work together to serve the community. So I'm going to transition to some other comments now. So return to work. We know yesterday at his press conference, Governor DeWine revealed more details about the Responsible Restart Ohio plan. Under mandated guidelines, the following businesses will be able to reopen. On Friday, May 15th, the personal appearances facilities like salons, barbershops, tanning booths, and day spas can open. On May 15th, also, outdoor dining at restaurants and bars can reopen. And on Thursday, May 21st, indoor dining at restaurants and bars can also start. There's guidance available on coronavirus.ohio.org on the stipulations for reopening. And so in the coming weeks, we'll see more people returning to work and more establishments opening up and more people out and about. It's absolutely essential that all of us continue to abide by the new social standards when we are in the company of other people. So we know when we talk about restaurants, we have longstanding guidelines to prevent disease transmission that relate to cross-contamination of food, temperature control. We need to add these social distancing guidelines as part of that understood health protection code for our community going forward. It is the only way forward. Wearing a face covering, maintaining proper social distancing, not shaking hands and hugging. We know that's a very human response. We need to avoid that in terms of transmission risk. And hand washing with soap and water on a regular basis, and surface cleaning, all of which are key components in this continued and expanded response. All these businesses will be working to follow these guidelines to protect their workers and their patrons from further spread of COVID-19. Now is not the time to relax. Now is not the time to relax. We need to double down on these preventive measures as we reopen in the coming days. All of us have a personal responsibility to protect each other. This is the only way forward. Changing gears, Sunday is Mother's Day. And we'll all be remembering our moms on Mother's Day. Hi, Mom. I know you're watching. And I'll be visiting you from a distance, either through FaceTime or on the phone with you to protect you. And I know you understand it. You're a You're a bigger public health advocate than I am, and I thank you for that guidance. And so we all learned a lot of valuable lessons from our moms, and we also have to remember that we have a responsibility that we all care deeply about in our hearts to protect them, to protect our moms. After all, they taught us to wash our hands and cover our coughs. It's not only polite, it's great public health practice. If your mom has underlying health conditions, a large gathering of people is not a good idea. It'd be better for you to call on the phone or have an online visit. If your mom has a smaller house or apartment, it may not be possible to properly social distance when people come to visit. Phone calls, group chats, and FaceTime visits may be the most protective choice for moms and families. So please do your best to help your mother and your entire family stay away from potential exposure to COVID-19. And happy Mother's Day to all the moms out there watching. With that, I'd like to transition to Dr. Heidi Gullett. Okay, we're going to pause momentarily in this transition, so bear with us for a brief break as we reflect on what our moms have done for us. Thank you.
Okay, we're going to go ahead and get started again. So thank you so much to all of our media partners again for being here. We really are so greatly appreciative of your continued support of covering this pandemic in our community. I also want to start my moment of gratitude with thanking my daughter. She made me this homemade mask, and like many of us on the front lines, our families haven't seen much of us in the past few months. And I thought that I came home last night and she said, I made you a new mask, wanting to protect me here, and I'm really grateful. So Ellie, thank you so much. I said, where did you get the fabric? She said, my leggings. So thank you to my mom who keeps watching our kids, but I'm not sure what she was doing when my daughter was cutting up her clothes, but it's all good. I'm gonna hear about that one when I get home today. But in all seriousness, as we head into Mother's Day weekend, there are very few things in life that are more important than what our moms do for us. And I continue to be grateful to my own mom for all that she does in taking care of our children and educating them as we both work out in the community during this time. And I want to recognize that pandemics don't stop to recognize holidays like Mother's Day. And so we want to honor all of those moms out there doing double and triple time, as you always do anyway, but with a layered pandemic on top. Your children are at home. Some of you are working from home on Zoom and feeding kids and educating them at the same time. And we thank you for all you do for our community, and we want to honor you this weekend. I'd also like to take a moment to recognize that we celebrated nurses this week. And it's a really important time to recognize those on the front lines but we have amazing nurses that save lives every day, that make our communities safer. And I want to take a moment to recognize those individuals. Ramona will talk about that a little bit more, but I have had the privilege over my career of working with extraordinary nurses who have taught me far more than I've learned in my formal medical education, really teaching you what you need to know to help be on a team and take care of people. So thank you for all that you're doing, risking your lives for all of us. And we have a truly extraordinary group of public health nurses here that most of the community doesn't know really exist, but they do so much day in and day out, pre-pandemic, now during the pandemic, and they will as we resume back to our regular public health activities. So thank you all, nurses far and wide. So we're gonna now transition over to our data summary. Before you turn the cameras, I wanted to say that we are presenting the general data that we present, and additional race and ethnicity data will be available on our website. We have a lot to talk about this morning, as you see, so I'm going to be a little more brief than normal, and then we will transition into talking a little bit more about testing. So you can also check our slides and some additional analyses that we've done a little bit later today on our website. So I will pause so that Heather can get positioned and the cameras can move over to the slides. Good. Good. Okay, great. So the first set of slides will be the Cuyahoga County Board of Health jurisdiction. This again includes the county without the City of Cleveland data, which they separately report. We continue to work very closely with our City of Cleveland Department of Health colleagues, and will continue to do so. The lab confirmed cases this morning are 1,540. Our probable cases are 457. The date of illness onset for these cases is February 28th to May 5th. And I'm very pleased to report our recovered cases continue to rise. We are now over 600 at 608. This for us is one of the more joyous parts of what we're doing in our public health response. Number of identified contacts is 3,315 and continues to rise substantially as you see our cases increase. The race and ethnicity breakdown for these cases, and that's a combination of lab confirmed and probable cases. And once again, probable cases are cases where people are symptomatic, meaning they have symptoms of coronavirus or COVID-19, and they have a link or they are a contact of a lab confirmed case, but themselves have not yet been tested. The racial breakdown for all of these combined cases is Asian, 0.7%, those identifying as Black, 34%, white, just over 53%, other, 2.9%, and 9.1% unknown. For ethnicity, 2.5% identify as Hispanic, 75.4% as non-Hispanic, and a little over 22% as unknown. And as I continue to talk each week, we're doing our very best to get complete information on every single case, not just race, ethnicity, and other demographics, but also information about symptoms and where people work and other demographics. The age range for these cases remains at less than 1 week of age, up to 101 years of age. Median age for our cases is 54 years, with 54% female, 46% male. Total deaths, and again, before I give fatality data at every single press conference, I want to take a moment to pause and recognize that these are families and individuals in our community. And as we enter Mother's Day holiday, you can imagine that those who have lost loved ones, this may be a particularly difficult weekend for them. So I would ask that you keep them in your thoughts and that you consider supporting someone electronically or socially distanced as much as you can. The total deaths in our community from COVID-19 are 105. That represents 104 lab-confirmed cases and 1 probable case. Dates of deaths range from March 20th to yesterday. I want to also take a moment to explain that all of the lab-confirmed cases represented here in the data around deaths that I'm presenting are people with confirmed COVID infection by a laboratory test, the PCR test that identifies active infection. The 1 probable case recognized here is someone who had COVID-19 symptoms and had a direct link to somebody who had a lab-confirmed infection. So I want to be very clear that these cases are absolutely COVID-19 related fatalities. And if there are questions about that, we are happy to clarify how we determine who qualifies as a death related to COVID-19. The age range for these deaths is 53 to 97 years of age, with a median age of 78 years. You can see that in comparison to the median age for all cases, which I just presented at 54. Sex, female 53% and male 47%. So these are the breakdown of the people who have died from COVID-19 in the CCBH jurisdiction. The racial and ethnic breakdown for deaths is Asian 1%, Black 26%, white 69%, unknown 4%, ethnicity 0% identifying as Hispanic and those who are deceased, and 80% identifying as non-Hispanic, with the remaining 20% unknown, which we continue to work on each week and continue to present you updated data as we obtain further information. Healthcare workers in our jurisdiction account for 22% of the infections, although nearly a quarter of our cases are still unknown status. Pre-existing conditions exist in about 42% of the cases, and those are underlying conditions I've previously discussed, such as chronic lung disease, diabetes, cancer, heart disease, and others. About 35% of our cases have an unknown pre-existing condition status. And the reason I think you see this unknown for these is that we had a considerable number of cases in the few days prior to pulling these data for analysis. So you'll continue to see us update this, but all of this more detailed information comes from individual interviews. And so we are trying to reach people as quickly as we can after diagnosis, but sometimes presenting this is a bit of a lag because we don't have that information on the day of diagnosis. This is the slide that I continue to just put in to remind you of what it means to flatten the curve. That means that we're keeping all of these cases hopefully below the level of surge that would overwhelm our hospitals. We have not had to make difficult decisions in this community about resources and who gets care because we've had enough. And our fellow Ohioans and our fellow Greater Clevelanders have really stayed at home and have done a really great job of the measures we've asked them to do to flatten the curve. But flattening the curve is not the end of the pandemic. And as you heard Dr. Boutros say, we have quite a few clusters that continue to rise up and will continue to rise up over the coming months. You have heard me talk about cluster investigations nearly every press conference. And so I'm very pleased we're not over that dotted line, but that by no means means that we are out of the woods and not susceptible to this infection. So this is our epi curve as updated this week. You'll continue to see a familiar part of the curve, which you've seen in prior weeks, but you'll also see a very nice increase in the number of blue lines, and those are the recovered cases. Again, on the far your right of the curve, you'll see that there isn't a lot of information about the red cases. Those are the newly diagnosed cases. And you'll also see that the number of cases here is a little bit lower than the total number of cases I reported. And again, that's because I present you with the most updated numbers from late last night, but these data are analyzed a few days prior to the press conference because they take some time. So these are a little bit lower than our total number of cases. And again, next week you'll see those dates filled in and another area that is our pending cases further to the right. This is our combined map for the city of Cleveland and Cuyahoga County. This is a frequency map, meaning this is simply identifying the number of cases in each of these zip codes. And this is a zip code where the case identifies they currently live. This does not indicate where anyone obtained the infection. We do know that household transmission is a very high risk, and we have seen quite a few cases of household transmission, but in many other cases, these infections were obtained outside the home, but this map simply represents where someone lives. I would also like to add that we continue to discover parties and gatherings, sometimes less than 10, but oftentimes more than 10. This week we had several where nearly everyone at that gathering is positive for COVID via lab confirmation. So please recognize, particularly as we head into a holiday weekend, that it is important to socially distance, it is important to wear a mask, it is important to frequently touch surfaces, because this is spreading even among families. Being with your family who lives in another household is a risk, so we really want everyone to do their part and prevent transmission, because this map gets darker every week, and we want to try to get ahead of further transmission, even between family members. These are the data around hospital utilization for the county, and again, these are all facilities in our county. We have, very similar to last week in the medical surgical beds, about 73% of our total availability. That's an increase of 3%. On the pediatric side, for medical surgical beds, we're at 53%, which is an increase of 11%. Critical care adult beds, very similar at 69% of the available beds are being utilized. That's an increase of 1%. And our ventilators are at 29% usage. That is unchanged, and the number of ventilators reported was also unchanged. So it's not that we suddenly got more ventilators and more people are on them. This is actually very similar number of usage since last week. And when I am able, our team here collates and aggregates testing data. This has been a challenge because we don't get negative tests reported given the volume of the COVID-19 test reports. But we have worked with our local lab partners to obtain as much information as we can. So these data that I'm showing you give you yet another kind of information about testing in our community. These do not represent labs like the ones being used at some of the local drive-thrus unaffiliated with our hospitals. So I don't have information from private labs included in this. These are really our hospital labs. So for the week prior to the data analysis, so that was last week into a few days ago, there were 10,588 tests reported to us that have been done. And the percent positive overall was 8.6%. But the range within those labs was 7.2 to 11.2%. So I wanted to give you a little more testing information as much as we could today with limited data, just to understand the percent positive of all the tests being done, how many are being reported positive. And there's a lot that goes into understanding what this means, but it's a general idea of how many tests are happening in the community. Please also know that these are not tests done on Cuyahoga County residents necessarily, because a lot of people are seeking care in our county that live other places. So recognize that this is everyone who was tested in the area, but not necessarily only residents of our county. So in conclusion, I'm going to reiterate the Ohio testing guidelines that Dr. Acton has set forth for us. Here at the Cuyahoga County Board of Health, we believe strongly in Dr. Acton and Governor DeWine and their leadership and the incredible plan that they have led us all through in protecting the lives of Ohioans and those in the greater Cleveland area. We will continue to follow their lead as they continue to help us understand how to best care for those in our community and to prevent as many fatalities as possible. This testing strategy is a key component of that. I have spoken week in and week out about my desire and our desire as a team to have more testing. And I'm incredibly grateful to our County Executive Budish and CEO Dr. Boutros of Metro Health for helping us operationalize or figure out exactly how to make this happen for our community. So we are going to follow these testing guidelines as we put forth community testing plans that you heard referenced earlier. In priority 1, we are focusing on hospitalized patients and healthcare workers. And as we've previously discussed, healthcare workers are broadly defined people who work in healthcare settings, within hospitals and healthcare settings outside hospitals, including our first responders. Priority 2 is Ohioans with symptoms. So again, symptoms of COVID-19 or coronavirus infection. And there are a lot of different symptoms, as we've talked about in the past. Those include residents of long-term care facilities or congregate living settings. And congregate living, much like flatten the curve, are terms the general public doesn't normally use. But in the pandemic, we've all gotten used to these other terms. So I want to define congregate living in this setting is 6 or more people living together, and that typically reflects places like assisted living, where people are not independently living but together, nursing homes, people come together to eat, come together for other activities, shelters, correctional facilities, group homes, and many other examples. So those are the ways we're thinking about this. You heard Dr. Boutros talk about the importance of focusing on these individuals in these settings. First responders, public health workers, and critical infrastructure workers. And the state of Ohio has clearly defined what critical infrastructure workers are, and you can find that on the Ohio Department of Health website. Those who are 65 and older, we know, as you saw, median age, for both cases as well as people who've lost their lives from this, older individuals are at more risk. Those living with underlying conditions, I referenced a few earlier. Those include things like chronic lung disease, high blood pressure, heart disease, diabetes, cancer, and others. And very specifically, you have heard us talk about equity time in and time out. Equity is the opportunity for everyone in our community to reach their full potential. And that means that when people have different opportunities, we need to think very carefully about ensuring those in the most vulnerable populations have what they need. So this testing strategy set forth by our state leaders, which we fully believe in here in the greater Cleveland area, is focused on those in racial and ethnic minorities, also with underlying illness issues. Ohioans without symptoms are also included in priority 2 if they are residents or staff who are directly exposed in the outbreak in a long-term care or congregate living setting. We have all heard reports of people without symptoms having infection and then spreading it. And so this is an important area where we're starting. It is not anybody without symptoms. It is this targeted group of folks initially without symptoms for testing. And then other Ohioans who are designated by public health officials to evaluate and manage community outbreaks. So these may include gatherings, which we hope are not happening right now, workplaces, or other settings that we identify through interviewing people who are cases and learning about where they have been exposed. In priority 3, it is Ohioans with and without symptoms who are receiving essential surgeries and procedures, and other medically necessary procedures that don't require an overnight stay. So for public health, we're focusing on priority 2, because that's where most of the work we do resides. So with that, I'm going to conclude my remarks and allow Heather to reposition back here and transition to my colleague Ramona.
Good morning. Today is an important day, so I'm going to keep my remarks brief. I think I would be remiss without acknowledging my own mother. I think I would get in trouble at this point if I didn't mention her. But truly, she is my best friend, and my parents are the reason that I am who I am. And also my husband, Eric, who's doing the primary care of our son. There's been a lot of days over the last few months where we haven't had the opportunity as public health to spend time with our families, and so it is because of our families that we're able to commit so much time to this work. But I couldn't let this day pass without acknowledging National Nurses Week. I've said before, I've been a nurse for almost 20 years myself. The week begins May 6th and it ends on the 12th, which is Florence Nightingale's birthday. The visionary of modern day nursing, the first person we ever learned about in nursing school. In fact, in honor of her 200th anniversary of her birthday, the World Health Organization named 2020 the International Year of the Nurse and the Midwife. A little prophetic in light of COVID-19. There couldn't be a better time to acknowledge the impact of nurses here locally and around the world. I remember a physician who was my mentor when I was in high school told me people don't care how much you know until they know how much you care. And he was right. It's a notion that I've carried throughout my career. The best thing I've ever done as a nurse is use my knowledge, compassion, and empathy to care for other people. To hold their hand or give a hug or reassurance in their best of times, which I worked in labor and delivery, so there were a lot of good times, and in their worst of times, when they got really devastating news. So people often remember the nurse who took care of them or their family member through a difficult time. But the truth is that every nurse remembers them too, and they change our lives as well. So every care provider deserves recognition for meeting the challenge none of us have ever faced before. But today I would like to acknowledge the nurses, whether they're taking care of COVID patients, and many of them are separated from their families to keep their families safe, and our L&D nurses, because that's where my heart lies, who are still working to reassure families and take care of them through a difficult time, and still acknowledge the great miracle that it is to have a baby. And our home care nurses that are still visiting the most vulnerable in our community. And educators who are figuring out how to prepare today's nurses, tomorrow's nurses, in a challenging time. And our own public health nurses, who are a small but mighty group, very passionate, whose work is often not seen. Visiting newborns and their families, helping child care providers take care of children with special health care needs, and making sure children and families have access to affordable vaccination, just as a few examples. One of the nurses who made an impact in my time here at the Board of Health, Sheila Dadich, told me once, I used to be her supervisor, give me all the people no one wants give me all the places no one wants to go to. That's where I want to go. So thank you. You all are amazing. So nursing is physically exhausting. I still remember the days of 12-hour night shifts, coming home with aching feet and calves, and there's no such thing as a lunch break or a bathroom break. And it's mentally challenging, all while doing that sacrificing of your own family and friends. But as difficult as nursing can be, sometimes people say it's the job you signed up for. And for me, I say it's the calling you answered. So I will always feel privileged and proud to be a nurse. And so to all my fellow nurses, happy Nurses Week. Perfect.
Thank you, Ramona, for those wonderful sentiments. And all the public health nurses here at the Board of Health and in the community for their bright minds and their big hearts. And I think a lot of nurses, in fact, I'm married to one, so I think that it's a wonderful sentiment. Ramona mentioned Sheila Dadich, who has an award named after her. Sadly, Sheila died a number of years ago, but her commitment to serve those that people often may find were challenging to serve and to ask for those families was a shining example of what public health is about. And I know Ramona knows that in her heart, and the award is meant to echo her life and her commitment and how that can be demonstrated in others on an annual basis. And so thank you. So with that, we are going to transition to our traditional question and answer phase of the discussion. And I'm going to start off by a question that we received already. And it is, how can people report concerns about retailers, bars, salons, et cetera, that are not complying with the guidelines for returning to work? And so to date, and from the beginning, local health departments have been central in the governor's plan to respond to concerns with businesses related to social distancing and a range of other health and safety issues. And so we'll continue in that role. Our number is 216-201-2000, and our phone bank continues to take questions. I thank them because after these press conferences, there generally are a surge of calls. And so they are here to respond. We're your health department, and we're here to help you. And so with that, I'd like to then move to questions we may have from our media partners.
Can you talk a little bit about any COVID-19 cases that have been confirmed in the Cuyahoga County Juvenile Detention Center, and is that now going to be a focus of testing moving forward?
The question is about cases that have been confirmed in the Cuyahoga County Juvenile Detention Center, and will that place be a focus for testing? So I'll first start off by saying we've been working with our partners at the Juvenile Detention Center for probably almost a month in advance in preparation. As we recognize and as we've seen at the state level in correctional facilities and the great work that's happened at the county correctional facilities, cases are going to occur. Cases are going to occur, and we know there already have been media reports about cases at the Juvenile Detention Center. And so we have been working with all these congregate facilities on a daily basis. We have a preventive medicine doctor that's coordinated by Dr. Gullett that is connected to every single congregate facility where cases are occurring. And there are regular calls. And so we've been with them from the start. We know that they've been planning. The clinical partner there is University Hospitals, working with the Cuyahoga County Juvenile Detention Center there. And we're going to work closely with them, and we'll be making determinations on the scope of testing that may be necessary in those centers. And right now, we have introduced the plan. We're going to begin the process of prioritizing locations. And these, again, are not individuals being tested. This is about thinking about practical ways to test large numbers of people and begin to use the testing capacity that Executive Budish is providing to the community through the county and through Metro Health, working closely with the health department to use them judiciously, and we intend to do that. We're going to take each individual situation on a case-by-case basis to make sound decisions on how to move forward.
How many positive tests have there been inside the center?
I don't know the current count. I know there were media reports about a couple cases. I don't, right now, myself, have the current case count, and we'll have to update you on that. But
there is at least one team in there?
I believe there, again, I don't have the exact numbers, but I would refer back to the recent media reports about the numbers. I don't have them handy with me right now.
Yeah, we're wondering, with this rollout of 30,000 tests, will the county, will Metro Health, will the board, make public the aggregate results of these tests so we can see how many are in each facility?
I think we'll have to look at that. We'll have to take that into account. I hadn't thought about that yet, so we need some time to think it through. I'm excited about this rollout to really start reaching folks that don't have a primary care provider, that have not had access to testing, that are in these high-risk facilities. And to me, that's our message today. We'll look at ways to report the data that is protective. And I think also we're thinking collectively about how we're reporting lots of other data about testing. And so we'll have to think how that can be displayed in a way that is protective. So we'll get back to you on that question. I don't have a good answer for you right now. Sure, please.
Just to quickly add to that, Courtney, and just responding to the question was about reporting of these additional facilities that we're going to test. We're still required to report all long-term care, skilled facilities, assisted living, and any licensed group homes. And so we will still continue to do the reporting that we do to the state, and then the state reports those out. So there'll probably be additional facilities that we're working with, some of which we've already been working with for a long time proactively, and doing lots of quarantining plans, et cetera, to prevent to prevent new infections and keep people safe. But I wanted to just reiterate that we continue to report where we are required as well by the state. So it'll be some combination of what the state asks us for and then what we feel we can safely, transparently present and still protect privacy for the individuals, particularly if there's only 1 or 2 infections in a certain location. Actually, while I'm up here, we had another reporter who emailed in who couldn't be here today, and I just want to share that question. So the question is, if an African-American person asks for testing, do they need to present with other symptoms? And at this time, we're talking about group testing in particular targeted locations. Some of those will be community settings, others will be organizations. But we are following the Ohio Department of Health priority testing guidelines, which do focus on people of color, but also recognize that they need to have symptoms at this time. We still do not have enough testing for the entire state. You heard Governor DeWine say that yesterday, as he has many other days. So these will continue to be revised guidelines that we will follow locally as additional testing is available. But we're pleased that we have a breakthrough at this point with a significant amount of testing, and we'll follow these priority guidelines. The second part of that question was, can doctors now prioritize them as a group? Doctors can still work within their own health systems to prioritize those that they feel need tested. We are looking from a public health perspective at who we need to test in the community based on these guidelines. But doctors and nurse practitioners and independent providers still have the ability to order for their individual patients that they see need this. And it's our hope that our providers, medical providers in the community, would consider equity when they're thinking about the context for each of their own individual patients.
The 30,000 tests that are part of this $5 million allotment, will that just be in the Cuyahoga County Board of Health jurisdiction? Will that
Great question.
spill into the city as well?
Yeah, Scott's question is, will this just be in the Cuyahoga County Board of Health jurisdiction or the City of Cleveland? I will quickly answer and say it's all of Cuyahoga County, but I'll defer to Terry if you have, he's giving me the nod that he has nothing else to add. So yes, it will be our entire Cuyahoga County community, which includes the City of Cleveland.
And I'm wondering a little bit, I know we've talked about the testing shortages in recent weeks and, difficulty getting supplies that are needed. Has what's, I guess, been holding up testing at these kinds of facilities, the fact that we didn't have $5 million to put towards it? Are these tests available right now, or are we going to have to wait a while to get the supplies and things needed?
Great question. So Courtney's question is, what has been the holdup so far, and are there still going to be holdups as we roll out this plan? So there have been a series of delays with regard to testing from the very beginning, including the first cases in Washington, which you heard play out across the nation. More specific locally, we've had a number of challenges. The first being we had issues with the actual collection kits being available. So we quickly ran out of swabs to do the swabbing of the back of the nose and throat or in the mouth. We didn't have enough transport media, which is the liquid that goes in the tube once the swab is collected. We didn't have enough tubes. And then once they got to the lab, we didn't necessarily have enough chemicals to run a large number of tests. So there were potential clogs at every step of the supply chain when it came to testing. And we have tried to be very creative. Actually, County Executive Budish's team and our team worked together to piece together test kits, which are going to be available for us next week, by finding sterile tubes that aren't normally the tubes we'd used. Our Ohio Department of Health helped us find some viral transport media that was made. And so we were creative about those. So those will be available starting next week. Actually, our colleagues at CASE we're so grateful they're actually using sterile pipetting for us to get the viral transport media into the tubes from your team. And then we had a donation of swabs. So that's an example of how creative we've tried to be about making these available. And then additionally, the Ohio Department of Health has worked really hard to get local health department test kits. So they have sent us test kits just like other local health departments. And so that's why we now have a little bit more availability, but certainly not the volume that we would need to test everyone in our community yet.
And I'm also wondering, I guess, a little bit about how you'll do work to identify where it needs to be tested. I mean, are all these congregate settings that you go into going to be places where you've already identified symptomatic people, or is there going to be a little bit of testing to see has coronavirus hit a facility we were previously not aware of?
So the question is about how we'll identify where we're going to test, and we've been working on this actually for weeks in anticipation of having more test kits available and more reagent available within the labs that run these. So this isn't something we just started doing this week. As you've heard me say many times, if I had anything to do with it, we're gonna get more testing here, and it's not because of me, but it's because of all these other folks who've come around us. But we wanted to be proactively ready to make this happen when it was available. So the approach we've taken is one that is equity at the center. We actually have an equity work group here that has been really looking at the partnerships that we have across the community between our two local health departments, Cleveland and CCBH, as well as other community partners. And so we're working with them to identify places that may not have had cases yet where testing would be really important, where people who are sick and haven't had access may be able to access. Maybe they don't have a car, can't use a drive-through, those sorts of things. And then the big point is this is simply an expansion of what we've been doing with Metro Health for the last 6 weeks. So we've been in these facilities testing. Our teams have been deployed using the few swabs we had and running them at Metro Health. So this is simply an expansion of that particular part of our strategy, which is just exciting that we can get so many more places which include in that and be more proactive rather than just reactive in the past. When we had a few swabs, we were mostly doing places where we thought there was really infection already.
So this could be places where we haven't seen a complaint.
Right, I mean, we're trying to be as proactive as we can. We're all about prevention. Public health is prevention at its core, and so for us, proactive and key prevention strategies are important, but we haven't been able to do that yet, and our hope is we are pivoting to that in this coming week and the subsequent weeks.
We'll take one more question.
Nobody has questions for anybody else up here? We got our leaders up here.
Heidi, can I just add something?
Please, Lorna.
Yeah.
You wanna come? Okay, so I'm away, I don't have to stay up here anymore?
So, back to your question regarding, is it a money issue? initially, when all the congregate living environments were told that they had to put processes in place, that became one of the concerns, right? Who do they contract with? How do they work with an organization, be it one of the health systems or a lab, to do that? And money actually is sometimes an issue. Many times it's not. But the process by which to have a system around them was difficult, even if they had the money for it. Because of County Executive Budish and because of the CCBH, we have eliminated that. We've eliminated the money issue. We've eliminated the process around to make sure that the tests are done in an appropriate way and the results are provided to them. So I think this announcement has helped clear a lot of hurdles for a lot of facilities that didn't know what to do. And as far as which facilities are we going to prioritize to be able to do testing, there are really three factors. One, are people symptomatic in that facility, right? So what's the level of symptoms of that facility? The second is, what kind of danger are they in? What is the underlying health conditions of the group, right? And finally is, what is the physical ability for us to distance people and to quarantine and to do a lot of public health initiatives in the physical space, right? The more constrained the space is, the more there are very vulnerable populations, the more symptoms there are, the higher level it goes into for us to do that. If we do not have any facility that we are looking at right now, we are going to go down the list and test different people. We'll go to contact facilities and say, would you like us to come in and be able to test your staff, all your staff and everybody today? I don't think that's going to happen. I think we're going to continue to see symptoms throughout, and we're going to be responsive to them as quickly as possible. One of the reasons I think the Department of Health likes working with Metro Health is that we bring the results back to them within 3 hours. So our test is fairly rapid. We send team members out to collect the tests so that people don't have to go through drive-through facilities if they can't. And we run the test and have the results fairly early on so that they can do the things they need to do as quickly as possible to isolate people and trace contacts. You're welcome.
Thank you, Dr. Boutros. As we wrap up, I want to thank again Executive Budish and Metro Health, Dr. Boutros, for the partnership. We look forward to working to better serve the community in places of high need. And the last thing I want to reiterate is that people need to know that our cases are not going down. We continue to receive case reports, and unfortunately and sadly, we continue to have fatalities. So even as we open, we need to double down on our social distancing messages, on masks in public, on our cleaning, on staying home when we're sick, on maintaining remote work opportunities wherever we can. We need to double down on these preventive interventions because they work, and they are the only way forward here for our community. And so we ask that you commit to do that. You work with your neighbors, your friends, and your families to protect them, to follow these guidelines, because this is our only way ultimately forward and through the process. I fear if people relax that our case counts will be more than any of us can bear. So we have to double down on this prevention. And I'd ask all of you to be part of that. So with that, we'd wrap up, and we wish you all a great, we do have a comment, a closing comment, of course, from our Executive Budish.
Not so much a closing comment. I think I misspoke when I was talking about the numbers for the small business, so I just want to make sure that's corrected. The county's putting in $2.1 million for grants. The Cleveland Foundation is putting in $500,000 for grants, and $100,000 of the Cleveland Foundation donation will be for administration. So it's a total of $2.5 million for grants in round 2. Thank you.
Thank you all very much. Have a great weekend.